Aneesh Chopra. So Aneesh is the president of Care Journey, as Delaware mentioned.
Thank you so much, Jessica, and to the Lumiata team for organizing this important opportunity. One is a little bit of a sobering assessment so far. The reality on the ground is that we're flying a bit blind about the COVID population. The Centers for Disease Control have published several papers on what we know today about the COVID population. And as they note in both of their most recent publications, we are largely inadequate in the information that's needed to answer basic questions. Are COVID patients hospitalized? And if so, with what frequency? What are their underlying clinical conditions? I think the March 28th report that showed something on the order of 90% of all reported cases lacked any clinical context about the patient at all is a sobering reminder that as we manage this crisis in the manner that Vinod outlined, the idea that we're either going to get the disease or we're going to have a vaccine, there are a number of decisions that are going to be made along the way, specifically around how to best prepare and manage if an individual is COVID positive. It is critical that this community come together to do what it can, not only to sort of supplement, if you will, the data gaps that exist, but to hopefully find insights that may be harder to find using traditional techniques. During my time as Chief Technology Officer, President Obama often said that we should tap into the expertise of the American people to help solve problems. And in the current administration, my successor, Michael Kratsios, had taken that same spirit by working collaboratively with of information. Jessica is part of the resource list, I believe, that we're going to make available in this hackathon. It is critical that we tap into the expertise of this community to mine as much of that information as possible to figure out the clinical characteristics. What do we know about patients that end up on ventilators and who need more advanced treatment options? And what are the characteristics that we could use to better prepare to establish guidelines or best practices as this permeates more and more of the communities around the country? For the policymakers, they might want to learn how we can make judgments about opening up the economy, neighborhood by neighborhood, community by community, and to see whether we've got the surge capacity such that if in fact there is another flare, we can have confidence that the healthcare ecosystem is ready. These questions of planning, of decisions that are made in the public sector can be benefited greatly from work that's done by stakeholders participating in this hackathon. And we're hopeful that by tapping into the expertise of this broader population, we're going to help present those information need it most. Thank you, Jessica, for the opportunity. I look forward to seeing what the community presents, and hopefully we can collective response through this crisis.